what are your thoughts on diabetes reversal? Can diabetes actually be reversed completely?
There are ways to discuss it. So it all depends on what your weight is, what your waist circumference is, what your current diet is, how old you are, how long your diabetes has been there. Discuss. Is my diabetes, can I do it without medicines? 10 minutes after a meal. It's good.
Achha.
So the biggest misconception is insulin is going to harm me. Needle, etc. That's a different story. But people think insulin is the end of the road for me.
End of the road.
मतलब हो गया, मेरा खत्म हो गया. Hypoglycemia is a true thing. So we say don't you do unaccustomed exercise suddenly. So I have never exercised and today I am going to climb Simhagar. Your sugars will fall. Or suppose you need to do it. We have, even in our OPD, we have pamphlets to read. So always add a carbohydrate snack before you start your exercise. And if the exercise is going to be of a long duration, like climbing Simhagar, may take an hour, keep something with you. If you feel the need, munch in between.
Hi. As clinicians, we see how diabetes can transform lives, but we also see how awareness can transform outcomes. Today, we are breaking down the essentials in ways that's practical, empowering, and myth-free. Expect sharp facts, early red flags, lifestyle truths, and some eye-popping signs along the way. Stay with us. This is the conversation about diabetes you didn't know you needed. Joining us today is Dr. Uday Phadke, an eminent endocrinologist with over 30 plus years of experience in clinical, academic, and research field. He serves as the Director of Endocrinology of Diabetes at Sahyadri Hospital, Pune, and is a graduate from BJ Medical College with DM in Endocrinology from KEM Hospital, Mumbai. A fellow of the American College of Endocrinology, he has been faculty for global academic programs by ADA, EASD, Johns Hopkins University, and the Mayo Clinic. He is also a respected teacher for the post-MD fellowship in diabetes and DRNB endocrinology. Dr. Phadke has presented over thousands of nationals and international conferences and contributed extensively to reputed journals. Honored with ADA's Bhivan Forensica Scholar Award, Inspiring Endocrinologist Award by Economic Times, he continues to contribute through his research, education, and compassionate patient care. Let's welcome Dr. Phadke. Hello and welcome to another episode of Sahyadri Health Talks. We are continuing our conversation with Dr. Uday Phadke on diabetes. So, sir, last episode we spoke about diet and the role of carbs and all that stuff. Now, moving on, I really wanted to talk to you about diabetes reversal, which has been a lot of discussion and a lot of information is available on that. But let's hear it from you. What are your thoughts on diabetes reversal? Can diabetes actually be reversed completely?
Great question, Trisha. And थोड़ा विस्तार से बात करना चाहूँगा इस पे because it's really the what shall I say, fashion of the current time.
It's a trend which is going
trend,
on.
And many people are jumping into it without understanding what it really means. Now, when you say diabetes, what exactly do you mean? Is it just blood glucose? No, it's not. That's what many people believe. That's only my sugar is high. When it comes down, my diabetes is reversed. But ultimately, diabetes is also about cardiac risk, cholesterol, blood pressure, amount of circulating fat in the body, liver fat, enhanced risk of kidney disease, etc., etc. So when you say diabetes reversal, you are talking about all these things coming down. Can you reverse diabetes? So when I say reversal of diabetes, what common people are now thinking is that my sugars came back to normal without a medicine, which is fine. Can you do it? Yes, you can do it. Can you sustain it forever? Difficult in most patients, most of the patients. Now, what exactly is done in diabetes reversal? So suppose I have a patient today who was diagnosed to have diabetes a few years ago or maybe just recently. And I find that his lifestyle is completely awry. his weight is more,
Hmm.
he has a paunch,
Hmm.
he's consuming more calories, he's more consuming more carb.
Basically, a bad lifestyle.
Correct. I change it and I get it to his optimal levels, and I'll see sugars falling down.
Hmm.
Either I can do it in this manner, which is a kind of gentle, slow, trying to holistic manner, or I can do it with some fat things. Now, there have been studies. The most important study that I would like, even people to look at. I'm sorry, but people don't really look at Google when it comes to diabetes. They don't really search all this. So there is a trial called the direct trial, which was conducted in UK. You know what they did was, they gave only about 850 calories a day for the first several weeks to months, in which the blood sugars came down, and gradually the calories were increased. So a lot of people, 60-70%, had remission of diabetes at 1 year. But now, as you gradually see, even in the study, in a controlled study, you will see that after 2 years, 3 years,
it's
again going up. So I don't mind even for 2 years if you're free of diabetes. That means a lot. But do something which is sustainable, discuss it, and do it. Just don't do it for the sake of using some fat diet for a few weeks, variables, lots of money spent, and then after a few weeks you just go back to your original lifestyle. How will that work? It doesn't work. So, in a nutshell, yes, definitely remission is possible. We call it temporary remission. So diabetes is controlled for a few weeks, months, years without medication. But it all depends on how sincere and long lasting your effort is. So don't go to quacks. Discuss it with your doctor. There are methods of doing it. So, and we are happy to help you here. But not everyone can revert. That also is true. Because ultimately it will all depend on how much insulin is produced in your body. So if that has gone, how can you reverse your diabetes? So not everyone. That's a short answer. What was the second question you said?
So I said, because everybody is talking about it.
Correct.
So, what message or what is the right information about?
So the right information is come and talk to a good doctor. Discuss, is my diabetes, can I do it without medicines or with lesser medicines? There are ways to discuss it. So it all depends on what your weight is, what your waist circumference is, what your current diet is, how old you are, how long your diabetes has been there, and so on. And then we can discuss it very freely. So it's not that non-doctors know how to reverse diabetes and doctors don't. That has been the general trend now. What your doctor is not telling you. Why should I not tell you? Why will a doctor not tell his patient what to do? And why will someone who is an MBA, BCom, knows how to reverse diabetes, but I don't? That's not true. So that's the fashion of the moment.
So
I urge patients to be very careful about this.
Be open, go and talk to your doctors if you really want to discuss about diabetes reversal, because the right person who knows all the values and the parameters is your doctor.
Absolutely.
Right? So as you spoke about lifestyle management also, which is a very crucial thing when it comes to diabetes management, what would be an ideal lifestyle management which is sustainable on a long run? And what would you want to advise your patients?
So essentially, first, let's discuss what lifestyle means really. So lifestyle means making changes in your daily routine, which will help you achieve best of health.
True.
That's in a very short nutshell.
Yeah.
Now, what does it entail? It entails exercise. It entails food or feeding patterns. It entails some kind of mental relaxation. You may call it meditation, some call it something else, etc. But the idea is that the cluttered mind should start relaxing a bit, because modern living is stressful.
Yeah.
And then also it's about sleep, the quality and pattern of sleep. And finally it is about vices. So overdoing of substances and leisure use of exactly. I would not call them addictions or anything. Not many people are addicted, but they do consume these kind of
in social gathering or
social
occasional
gatherings, and then
stuff
it
like that.
starts becoming a habit.
Yeah.
Yep. So let's take quickly exercise. When we talk about exercise to our patients, exercise broadly is three types. One is cardio. Cardio is like jumping,
We
running,
run,
cycling,
yeah,
swimming, walking, where you increase your heart rate to a certain extent, keep it there, and then slowly get down. So it's very good for the heart, very good for losing weight, and good for muscles, good for your circulation, everything. So that's one kind. And we urge them to do at least 30 to 45 minutes minimum per day.
Okay.
You can go up to more depending on your
Stamina and your
ability.
habits. Yeah.
The second form of exercise is called resistance training,
Acha.
where you work against exercise, you work your muscles. So typically gyms where you use bars, dumbbells,
Body
ropes,
weights and
whatever, body
etc.
weight. And that helps in stimulating muscle growth, and muscles are the one which will consume sugar. So it helps. It also helps balance, it prevents fractures.
Correct.
Whole lot of things.
Yeah.
And the third form of exercise is called stretching or posture.
Which
So
I think
like yoga.
Yeah.
So basically you learn how to stretch your muscles, stretch your joints, because it gives your body a overall good things. And if you combine all these three, not just run every day, not just gym every day, but combine everything together, it gives you the best results. And each has a different benefit.
Yes.
So we ask them to do that. I told about diet. So we sit with patients, plan it. We reduce calories a little bit, we reduce carbs a little bit, we reduce fats a little bit, talk to them about different fats, different in diet. So what we do now in India is we realize that you cannot cut out carbs completely, no matter what you say. If I tell you not to eat roti, what will you eat? Ultimately, when you go home, what will you eat with your dal and sabzi? So then you can make roti differently. You can use plain wheat atta, or you can mix several attas into it. It's like a multigrain flour. So that kind of a thing. So these things become important. Small tips, how to cook, how much oil to use. People don't have any concept of how much oil they are using. They'll say, no, we don't fry anything. You don't need to fry. But how much do you need? You need ideally about 25 max grams a day per person. But in a family of two, if you're buying 5 liters, where is it going? So it all depends on that. People are very fearful of fruits. We tell them that fruits are so important because they give you vitamins, antioxidants, fiber. But how to consume fruits? How much fruit to consume? Can I never eat a mango? All these come up in discussions. So that's about food. About decluttering, we do tell the patients that's the most difficult part, because everyone is on a mobile. People don't sit and read some novel. They're either watching TV and just something is going on, you don't even know what's going on, or you're just scrolling on your mobile. So we tell them, just shut your mobile, go for a walk, listen to music, do what you like, but don't look at that damn thing. It's a difficult proposition, but we do encourage them to do that. And sleep is something which is important, not always doable, because people are following different shift works and so on.
And all that.
But we do tell them that do try and go to sleep, do try and not stimulate. So
recommended hours?
It's about 6 to 7 hours also is good. And there is a pattern of sleep. So it's not that you go to sleep at 3 in the morning and sleep till 10, you get your 7 hours. It's not like that. Sleep has its own rhythms of REM, non-REM. And nature has designed that as there is sunset, darkness, you should start resting. And previously, someone would say, oh, you're talking like an old uncle. It's no more true. So we now have these diurnal genes in our body. They're genes setting this whole rhythm. And if you try and go against them, they do create problems.
So, sir, people who are working in night shift and US shift, so what message do you have for them? I mean, how they can improvise their life, considering that they work in all these shifts?
Difficult question. What would you say? I mean, I don't have a clear answer, and nobody has, because it's their job which is making them. So I don't think they're doing it by choice.
Nobody does it by choice.
So for them, it's very difficult. But for those who are not in that kind of job, I would say start decluttering your mind around dinner time.
Mm-hmm.
Stop stimulating your mind too much around that time.
Hmm.
Start doing some read, tone down your lights, don't listen to loud music.
Mm-hmm.
Slowly sleep will set in. So that's how it has to be.
Hmm.
So I don't have a gyan to give. I think people have to become aware of and cognizant of these lifestyle habits. These are simple things, but they do go a long way. So the age old adage is go to bed early, wake up early, makes you healthy. So it's not entirely just like a pravachan. It has some
Value,
scientific
meaning
meaning also to it.
also
How much you can follow it is your,
is up to you.
yeah,
It's up to you.
absolutely up to you.
So another thing which we, while I want to talk all about it, but we have limited time. But I just wanted to, have a basic knowledge about this gestational diabetes. So what we know that it comes during, it happens particularly during pregnancy. What message do you have for people who are diagnosed with gestational?
Great question, because actually when I started out, we did not have lots of gestational diabetes. What has changed? So essentially, gestational diabetes means diabetes which is detected in pregnancy.
Hmm.
Okay, and typically it comes at about second or caused by pregnancy. Let's
Acha.
put it better that way,
Mm-hmm.
because you may have diabetes beforehand and it can be just diagnosed in pregnancy. That's not called really gestational diabetes. Gestational diabetes means whatever changes occur in the body, in a woman's body,
Mm-hmm.
because of pregnancy,
Mm-hmm.
tend to elevate your sugar.
Mm-hmm.
And that typically is seen towards about after about 20 to 24 weeks of pregnancy.
Mm-hmm.
Now, gestational diabetes always is more
Hmm.
if the background community has a large incidence of diabetes, like in India.
Mm-hmm.
If your parents are diabetic,
Yeah.
and you're obese.
Acha.
So, people, my advice to women, young women who want to conceive,
Hmm.
is get yourself checked
Acha.
before you plan conception.
Okay.
Don't leave it till the third trimester of pregnancy.
Especially when you have a family history.
Exactly. And start behaving as if you're diabetic, even when you do not have diabetes. Because
Okay.
it's not that you need to start dieting and exercise only after you develop diabetes.
Hmm.
Of course, you can do it beforehand also.
Yeah.
So that does go a long way, and monitor. And then, of course, after doing all this, if you still develop it, we have ways and means to clearly tackle it. Because it's important, because a child's growth, any human's growth, let's say there are 8 phases or 8 cell developments, 7 of them are finished when you are inside your mother's womb,
Yes.
and only one occurs later. So, whatever happens to your mother
Mm-hmm.
when you are in the mother's womb clearly affects you also
Hmm.
as an adult. So, that is called the fetal infant origin of adult diseases.
Acha.
So, that's important. Therefore, a woman must take care not only for herself
Acha.
but for her child.
Okay. But suppose somebody has developed it. Okay. So what precautions or what are the things that they should be
So there are
taken
two
care of?
important things. One is diet,
Hmm.
and a tendency of lot of doting mothers and mothers-in-law is to feed that.
Yeah, because you're eating for two.
अरे आप दो के लिए खाओ
दो के
अभी,
लिए
और
खा
ये
रहे हो.
खाओ वो
Yeah.
खाओ, ये लड्डू खाओ वो फलाना खाओ. It's not necessary most of the times. So we do need to take care of the diet very quickly, and that reduces sugars quite a bit.
Acha.
And if that doesn't happen, there is one medicine, metformin, which is allowed in pregnancy,
Mm-hmm.
and then insulin.
Mm-hmm.
But it can be controlled. That is for sure.
So it's not a
Impossible thing.
to manage it during pregnancy.
We can manage it easily now.
Okay. So I just wanted to talk about continuous glucose monitoring and the wearables. As we spoke during the conversation, that technology has advanced so much that it enables you to keep a personal check on your sugar levels all the time. So what role does CGMs and wearables, what are your thoughts? Are these important?
They are. I think they are great advance in our understanding of disease processes.
Okay.
The first thing that we understand is when people start using wearables or even checking their glucose by glucometers, the first thing that they come and tell us is, oh my God, there are so many different values all through the day. I said, that's how it is. Because everything in life has a variability. You check your blood pressure 10 times in a day, it will be different.
Yes.
It will not be the same. So this variability is picked up on these variables because it's there 24/7.
True.
Where it helps really, is two kinds. One is a newly diagnosed person who, where we use these variables to see the effect of their lifestyle, which is food and exercise, on glucose values. So if I eat paratha with chole or aloo sabji, what will happen? Versus if I eat just a multigrain roti with bhindi sabji, what will happen?
Or maybe I add a salad before my
Exactly.
food.
Exactly. So if I added a salad, what happened? If I had an ice cream or a pizza, what happened? And that helps them, that they know now that I have known on my CGM that if I eat 2 slices of pizza, I'm going to go through the roof. और डर लगने लगता है.
हाँ जी.
Because they know at least. So that helps a lot. What is keeping their... So sometimes you realize that if you mix a little roti with little rice with dal and sabji, things don't go wrong. So then they are comfortable. कि अच्छा, इतना मैं खा सकता हूँ.
This is safe for me.
This is safe for me. So that is a great learner. What helps me? And the second way we use it is in people who have more severe forms of disease. We are using multiple insulins. The sugars are variable. They're not getting under control. We need to understand patterns through the day. Where should I place my medicine? Which kind of medicine?
Which hour of the day is shooting very high?
So there it helps on the other hand. And then there are variables now for blood pressure. So you know that there are people who normally our blood pressure dips at night.
Achha.
Now we don't get up in the night and measure our blood pressure. It's not possible. But if you wear this device, it will tell you whether this is dipping or not.
Yeah.
If it is not dipping, I have a different medicine. True. So these variables have clearly become important. They have to be used correctly. They have to be read by a person who knows what to read, what metrics is to be used. So they are not to be used as just some fashionable device. You see at the airport now, so many people are wearing those variables. And if you ask them, "Hey, aap kyun pehne ho?" Everyone is wearing them. That's not the idea.
It's more kind of a smartwatch.
Exactly. And you will get all, it's a continuing running thing on your phone or your watch. But it makes a lot of difference.
But do you also feel that it kinds of creates an anxiety?
It does.
Patients?
It does. So people are afraid. But because in the beginning, when they're uncontrolled, they're afraid of looking at those values because they know it will come high.
Yeah.
But I tell them, look at it the other way around. If we recognize those highs and treat them, and then if you start seeing everything come back to normal, you will feel happy every time.
Yeah, true.
So it has a it's like a double-edged sword.
Yeah.
We are using the data to help you, not to blame you. So शुरू में होता है anxiety because every time I look at this, oh my God, it's 280, it's 350.
Yeah.
What do I do? So don't panic. We are going to use that data to improve you.
And if you're using it, make sure you have a proper documented chart of it.
Correct. Absolutely.
You should know where it is shooting.
Yes.
Or else it doesn't make any sense.
Otherwise, it doesn't make sense.
So what are the technological advancements coming up in diabetology, which really excites you and you're looking forward to it?
Great question. So there are many. On the therapeutics front, there are some medicines now, pharmaceutical agents, which have totally changed diabetes outcomes. So they are extremely beneficial for kidney and the heart. And two such medicine. One is called the GLP-1 analogs. You keep hearing them about now, Ozempic, Mounjaro, Wegovy. These are the GLP analogs. And the SGLT2 inhibitors, dapagliflozin, camagliflozin, empagliflozin. These have really changed things. That is on the pharmaceutical aspect. On the technology aspect, people with type 1 diabetes or very insulin deficient diabetes had a very poor life quality. Their sugars are constantly up and down, and sometimes they go to 400, sometimes they go down to 30. The same food, same insulin, everything. It was a miserable time and nobody could do much.
Mm-hmm.
Now we have these automated insulin delivery systems.
Mm-hmm.
So the automated pumps,
Mm-hmm.
which will measure, calculate, and give on a minute to minute basis. It's like emulating your own natural pancreas.
Mm-hmm.
That's a great advance. It's still expensive, but
Mm.
it's possible. And the next major breakthrough in diabetes therapies will be cell based therapies
That's
and gene based therapies, where you can actually put in cells which produce insulin
mm-hmm.
like a normal person, the beta cells. It's still not completely there yet.
Mm.
There are many shortcomings and some roadblocks, but it will come.
So we have promising
100%.
trials going
Definitely.
on.
Definitely.
Okay, sir, that's about that. Now, moving on to the last segment of this podcast, which is I have some questions which are like quick rapid fire, and most of these we have already discussed. So, asking these so that we can close it for once and for
All right.
Yeah. So the first one goes is, what's one lab value other than A1C that clinicians should pay more attention
In diabetes, it has to be cholesterol also.
to? Acha.
And HbA1c is a 3-month thing,
Mm-hmm.
but individual blood glucoses, fasting, and post meals are also important.
Acha. Okay. Which diabetes myth frustrates you the most in clinical practice?
The most frustrating myth is people believe that it is the medicines given by the doctor which is going to harm their kidney and heart and not their
Not the
diabetes. So that is very frustrating. I said, why are we treating this? Let's let it go. But that's a myth which is propagated. I don't blame patients for it.
So we
It's a
need
myth,
some
yes.
time and awareness.
Medicines
and
are there to help you.
Yeah. What's your go-to first lifestyle change when a patient feels overwhelmed?
The first lifestyle change is keep it simple. Just sit down, discuss with us what you can easily follow, and just inculcate those 2 or 3 things. Just start walking 5 minutes after every meal. That's still a lifestyle change. Just reduce your carb by 10%. Big change.
You really don't have to do something
no,
very
I don't
major.
have to do something very, very, very big. Start doing it in small steps.
And you will
will
see
get
the
there.
changes.
You will see the changes.
What's one CGM trend that tells you a patient's routine needs adjusting?
So the most important trend that we see is variability, ups and downs, peaks and valleys. That's not what I want. If it's continuously high, I know what to do. But if it's going up and then crashing, that's worrying for me.
Which medication class do you think is still underutilized?
GLP-1 analogs, the one which I talked about.
Spoke about.
Probably because they are injectable and expensive right now. And a lot of myths again are being spread around it, but they are underutilized.
Okay. What's the most common dietary mistake patients make without realizing it? You have lots.
Yeah, there are lots. But portion control is something which people don't understand. So they don't understand that if I eat less, it is better for me. They think only this I have to avoid. I didn't eat sweets, but if you eat 3 chapatis, that's the same as eating, say, 1 mithai ka piece. It's a slightly different way. So portion control is important.
Okay.
And sometimes letting go completely on weekends is troublesome. You follow for 5 days and on a weekend you binge and then you have had it. There's no point.
Then there's no point. Okay. What's one small habit that makes a big difference in post-meal spikes?
So as I said, people have shown this with studies. If you walk 10 minutes after a meal, it's good.
Acha.
So walking is good in general. Exercising is good.
True.
But after a meal, just be active for 10 minutes. It helps. Because your muscles are active, they pull out the sugar from the
meal walking.
Yes.
Okay. What's the most useful but underrated question you ask patients about their day? Most useful but underrated. I mean, patients think, "Kyun pooch rahe hai?" Do you have anything?
I don't know. I'll have to think about this. You stumped me with that. Do you have something in mind?
I don't know.
I'll have to think about this and tell you again. But
okay, we'll keep it for later.
We'll keep it.
Yeah. Okay. What's the most useful? What's the biggest misconception patients have about insulin therapy?
All
Biggest
right.
misconception.
So the biggest misconception is insulin is going to harm me.
Hmm.
Briefly, I'll tell you, most people have seen people, relatives,
Hmm.
taking insulin
Mm-hmm.
because they had a severe disease and insulin was already late. And after starting the insulin, they succumbed because of the disease.
Mm-hmm.
Because it was already, they had some heart disease or kidney
It
disease.
was already
It was
complicated.
all complicated disease.
Mm-hmm.
And now they are blaming the insulin for it. So
Yeah.
people are very scared of insulin.
Huh.
Needle, etc., is that's a different
Fine.
story. But
Yeah.
people think insulin is the end of the road for me.
Yeah. End of the road.
मतलब हो गया मेरा खत्म हो गया अभी and
Huh.
this is going to harm me. That's a big myth, which is not true.
Okay. What's the simplest way patient can improve their time in range?
Regularity. If you stick to a schedule of diet, exercise, and medications, time in range improves. You need to choose the correct medicine, etc.
Mm-hmm.
But your regularity matters.
Hmm.
Because if you keep fluctuating your lifestyle, if you keep binging, if you keep missing medications or meals, then the time in range changes. So regularity, discipline makes a lot of change, and of course, a correctly used medicine.
Yeah. What's your quick tip to avoid exercise related hypoglycemia? Exercise related
So
hypoglycemia.
exercise-related hypoglycemia is a true thing. So we say don't you do unaccustomed exercise suddenly.
Mm-hmm.
So I have never exercised, and today I'm going to climb Sivagar. Your sugars will fall. Or suppose you need to do it, we have even in our OPD we have pamphlets to read. So always add a carbohydrate snack before you start your exercise. And if the exercise is going to be of a long duration, like climbing Sivagat, may take an hour,
Mm-hmm.
keep something with you.
Mm-hmm.
If you feel the need, munch in between. So that is something which is important. The second important thing, you asked me about exercise induced hypoglycemia, but we also caution patients who are severely uncontrolled against exercising very severely, because sugars actually tend to go up,
Acha.
not
Okay.
go down.
Oh,
There is a
okay.
reason for that.
Okay.
But on both aspects,
Acha.
we tell them to be cautious when they are doing strenuous exercise, to carry something in their pockets, because sugars do tend to go down.
Do tend to go down. Okay. What's one thing you wish every newly diagnosed patient heard on day one?
As I said, two things that I want to tell them. On the positive aspect, I want to tell them that look, you can have a completely normal life if you follow good advice. And the second that I want to tell them is that this can be progressive. It may appear negative, but I want them to be prepared. But the most important thing is we will treat it and you will have a completely normal, useful life.
And it's not end of the tunnel.
Absolutely.
On that note, we before we let you go, share some case with us which was really challenging, very close to your heart. Some stories.
There are many actually. There are some in type 1, some in type 2. But forget the blood glucose control of it. I was telling you that type 2 diabetes is not one disease. There are whole lots of things which come up with that. And I saw a doctor from a peripheral town, small practice, who came to me with obesity, diabetes. And of course, his sugars were uncontrolled. So I was taking the whole history. He started crying. Adult man. I said, अरे क्या हुआ? He said, सर वो शुगर वगैरह तो ठीक है, वो आप देखो, बट मेरे लिए कुछ करो. He said, off late, when I am sitting in my clinic and talking to my patients, I tend to fall asleep. So the word has gone round that this man is not interested in us. He tends to go off to sleep when we are talking to him. उसका patient में interest नहीं है. So my patient population has started dropping.
And he has absolutely no control in it.
He said, I just go off to sleep. So we analyze, this is a typical sleep apnea thing. He was obese. And we told him about weight loss medications, which is used as anti-diabetic. He came back after a month. He fell to my feet. Imagine someone, an adult. And he said, last 1 month, I have not had this happen. Because, actually these medicines not only reduce fat, but they also reduce the fat and the soft tissue in the neck, which is causing the tracheal compression and the sleep apnea. So he said, I've stopped sleeping. suddenly people have spread. It's a small village town.
Yeah.
They said, अरे अभी डॉक्टर ज़्यादा अलर्ट हो गया अभी,
Ah.
थोड़ा वेट भी अच्छा हो गया, अलर्ट भी हो गया, अभी अच्छा दिख रहा है. So he said, forget my sugars, forget anything else. This is so much of a change for me,
Yeah.
which I didn't realize. So these are some of the things. So when I said you cannot just treat diabetes as blood glucose, no,
Correct.
this is something which was missed.
Yeah.
So great. I mean, it changed a person's life.
Yeah, I mean, and it was impacting him professionally, and especially in in the medical industry, where the word of mouth matters a lot.
Absolutely.
It must be life changing, miraculous for him.
Absolutely life changing for him.
For
I
him.
was so glad.
So, so nice to hear these stories from you. And my last question to you would be that I have seen your OPDs. I have seen. I know how much I had to follow up with you to get this appointment. So, how do you manage yourself, and how do you wind up after a long, tiring day? What do you do to keep yourself?
So without trying to appear pompous or anything, I practice what I preach. So if I tell my patient to exercise and diet, I make sure that I do it myself. So I'm a very avid trekker, mountaineer. I take time off in a year to actually go to very high areas. And I exercise daily. And I seriously follow what I tell the patients about food and all. Of course, I also binge sometimes. I am not complete yogi kind of a person, but I'm saying that even if you do 80% of what is told to you, or 75%, it's still good. So I still do walk. I close my OPDs in the evening, so I get time to do something for myself, which may be anything: photography, cycling, walking, or doing nothing also is fine. Yeah. But you must have some time.
So on that note, do you have any final message for all our viewers?
Thank you. I think this was a great talk, and I hope that if you take away some of these scientific messages from this and go and read them for yourself, for those who are net savvy, you'll find a lot of good information on the net and a lot of trash also on the net. So you'll have to start sifting it and follow science, follow science, follow science. Science is important, and science is for you.
On that note, thanking you so much for giving us this time. We had wonderful 2 episodes on this, and while I want to continue this discussion more, but we have time limitations, looking forward to have you again on this podcast. Until then, thank you so much.
Thank you very much for the invitation. It was a great talk.
Thank you, sir. This is Dr. Tushita signing off, Sahyadri Health Talks.